ಮುಂದಿನ ಒಂದು ವಿಷಯ ನ್ಯಾನೋ ಮೆಡಿಸಿನ್ ಬಗ್ಗೆ, ನ್ಯಾನೋ ಟೆಕ್ನಾಲಜಿ ಕುರಿತಾಗಿ ಡಾಕ್ಟರ್ ಕವಿಯರಸು ಬಾಲಕೃಷ್ಣನ್, ಸಂಸ್ಥಾಪಕರು ಹಾಗೂ ನಿರ್ದೇಶಕರು, ಮನುಷ್ಯ ಬ್ಲಾಸಮ್ಸ್.
Thank you for giving an opportunity to stand before you, to AYUSH TV and Swamijis and everyone. So today I am here to talk about the finest medical practice in AYUSH, which is nano and quantum in nature. You kindly join hands with us. Let us see how best we can help the humanity. So it is almost 600 years of research of my family and 30 years research of mine. Today I have brought to the people, and it is the divine community. Doctors, you are the right channels to take it to the humanity. There is a unique medical practice in AYUSH, which is nano and quantum in nature. So you can see certain slides in the bottom of the presentation, which is taken from transmission electron microscope of some of our medicines. I am heading the research and development. I am the managing director as well as heading the R&D of nano division in Manushyaa Blossom. And we have performed around 25 years of multidisciplinary research to understand why a human get a specific type of disease at specific point of time in life. So there are, according to Siddha system of medicine, there are 4,448 diseases totally. So out of this, always when a patient come and sit before us, we should know why this specific patient got this specific disease at this specific point of time in life. This is where the diagnostic starts in Siddha. And we have, based on this, we have developed an artificial intelligence tool, and we have done the nano mineral profile of the brain and converted that into an artificial intelligence engine, which is available for doctors for diagnosing rare diseases. If a patient comes in front of us, and we don't know why this patient got this specific disease and what is the root cause of the disease, this specific artificial intelligence tool helps us to understand the patient and the origin of disease. This is available. When you start working with us, we will share this knowledge with you. See, what is the beauty of nanoparticles? Okay, so the nanoparticles generally get delivered in two forms. One is in the form of a drop and another is in the form of solid metallic powder, which gets dispersed through something called self-emulsified drug delivery mechanism. This word self-emulsified drug delivery mechanism sounds very peculiar to AYUSH doctors. It is nothing but mixing the medicine with ghee or honey and delivering it to the patient. It's called self-emulsification. And the beauty of this nano drugs is a drop of nano drug, we have 100 trillion particles. And when you give 3 drops, it's around 3.1 into 10 power 15 particles getting into the system in one dose. So if it is 2 doses per day, it means around, you say that 6 quadrillion particles we are sending inside when it comes to nano. So we have gone beyond nano, that is quantum. These quantum dots are less than 7.5 nanometers. Less than 10 nanometers is called quantum. Somewhere between 10 nanometers to 100 nanometers is called nano. And these quantum dots are probably 10 times more efficient than nanomedicines. This is a data given by WHO. The mental health related economic loss to government of India is 1.03 trillion US dollars. So at least 1/20th of it belongs to Karnataka. Okay. So out of, so this is where the challenge is. The second biggest challenge is antimicrobial resistance, where when we were young, the tablets given to us will be 5 milligrams and 10 milligrams to combat the bacteria. Today, if I are giving 500 mg and 1 gram, still the antibiotics doesn't work, where the AYUSH doctors has a very key role to play. Anyone having urinary tract infection, prolonged urinary tract infection, anyone having serious lung disorders, where this nano medicine plays a very great role. as well as the mental. When it comes to mental health, the biggest challenge is crossing the blood-brain barrier and getting inside the brain, where this nano drugs and quantum drugs has a very unique role to play. So this is autism. See, according to the Lancet report, it is $16 trillion is the world economic loss due to mental health. And the antimicrobial loss is associated is around 100 trillion US dollars. So this is not only the Indian market, you have the global market also. So Karnataka is very well connected to entire globe, on the coastal line of Karnataka. So it is a great opportunity. By associating with us, we can handle the local patients as well as the patients from international community. Next slide. See, these are the three people. They got Nobel Prize last year for discovering quantum dots. Okay, they have discovered quantum dots for electronics and industrial application. There was nobody, that the quantum dots was not only meant for industrial applications. There was no research in biological contribution so far in the world. Next slide. There was a person called, the Siddha system of medicine is very closely connected with Karnataka state. So Shiva, as per the Siddha system of medicine is concerned, Shiva is considered as a vice chancellor of a Siddha university. Okay, Shiva himself wrote 6 lakhs granthas in Siddha system of medicine. The 6 lakhs grantha we lost, we don't have his books. But there is a person called Konganava. He belongs to the Kongan region of Karnataka. He has wrote 3,000 verses. He has written 3 volumes in Siddha medicine medical system. In 1271, Marco Polo visited Indian coastal line. When he seen certain people in Malabar coastal line, that is in the Kongan belt, he has seen people at the age of 150 to 200 years. So there he wrote a small note on this matter and sent it to US. The Chicago University has sent a professor called David Gordon White, and David Gordon White came to India and spent 15 years running after what they have done to understand how they have lived such a long duration. And nowadays the anti-aging is something, a market which the entire Europe, US and Japanese, they are so fascinated about anti-aging market, and you can see the market is flooded with a lot of nutraceutical formulations on anti-aging. We are the best in the world. The India is the best in the world in anti-aging. So we have been seeing our yogis living for such a long duration, and so we have the best in the world for anti-aging related medicine. This is gold quantum dots, less than 10 nanometers. So what we did is, when we tested some of our materials with a transmission electron microscope, we found that they are less than 10 nanometers. We got puzzled. So how come the process taking us to this particle size? And we have disclosed these details to some of our renowned scientists in Government of India who founded CDAC in Bangalore, Dr. Vijay Bhatkar. So I went to Pune and told Dr. Vijay Bhatkar that no, we have discovered gold quantum dots. He said, I don't believe. So then we went to CMAT. This is a center for material testing laboratory, and these are the results. You see 3.42 nanometers, 4.97 nanometers, 5.02 nanometers, these quantum dots. So we probably, I don't know how many other people performing research in this. This is one area where the world is still exploring. They have not done anything on the biological front. The quantum dots for biological application is not has come to the market. But we have been selling this product for more than 7 years, producing and selling it in the market, local market as well as in the international market. It works amazingly for Parkinson, Alzheimer's, and this kind of aged diseases. Next slide. These are some of the products we have developed. They are very unique in nature. That is for aging and sleep disorder, antimicrobial resistance, anxiety and depression, erectile dysfunctions for men, neurological disorders, IBS, irritable bowel syndrome, and liver disease. So we have exactly a nano element for these applications, biological applications. This gold quantum dot is one of our product. The Dream Aura is a nano liposome. The Nano V, it's a quantum liposome which is meant for antimicrobial resistance. Amara is a quantum drugs for anxiety and depression. See, out of 100 cases in India, 80 cases are divorce cases. All these divorce cases happens, sorry, it's because of anxiety and depression, mood swings, bipolar nature of the patients. So what is the exact reason for this anxiety and depression, suicidal tendencies, bipolar? Happens very deep inside the brain. So how to cross the brain, reach inside the brain, the endocrine glands and the hypothalamus, and how to reverse the conditions so that these patients come out of this illness is a very unique art. Our nanomedicines does this very beautifully. 80% of the divorce can be prevented using our nanomedicines. So if you come across any patients having both men and women having extreme mood swings and hyperactive nature and any kind of psychological disorder. See, the psychology is one gray area where AYUSH doctors can play a very, very big role. Because a person already having psychological disorder, when he goes to the psychologist, then psychiatrist, they ask, what is wrong with you? So how come a psychologically affected patient able to express themselves and tell them what is their problem? It is impossible. So psychology and psychiatry fails there. So we have a very unique mechanism using artificial intelligence, which will give an insight what exactly wrong with the thought process, why a person thinks in a specific way. That is what we understood, okay, in terms of mineral profile, and we can able to send these nanominerals to the brain and recover the patient. These are the analytical instruments we use when we produce the nanomedicine. See what has happened during the Prime Minister Vajpayee. There was a Nanomedicine initiative by Government of India. India has set up nanotechnology facilities across the country. We made use of these nano instruments to produce our nanomedicine. Once we produce the medicine, it undergoes nearly 21 different tests before it comes to the doctors. Apart from this, we do cell line studies, animal studies and human trials. So we are a GMP certified company. Our job is nano drug design, synthesis and delivery. We have discovered nanomedicine for autism and related child neurodevelopmental disorders, and we have done successful clinical trials also. Apart from autism, ADHD, intellectual disability, anxiety and depression, bipolar, stroke is our expertise. See, for example, there are children, those who could not able to perform well in studies. Okay, so what we are doing, we are giving intense training. That is one way of approaching the problem. The other way of approaching the problem is evaluate the IQ of the person, and we can use our nanomedicine, we can develop the IQ of the person. Every 50 days, one mandala we call it as everyone knows, for a child of 5 years old, we can develop the IQ from 8 to 10. For example, a child having 85 IQ, struggling for studies, can be pushed to 100 plus in 6 months, so that the child can become a normal or better than a normal child. So this is not only for the children, this will help for students, college-going students, those who want to crack the competitive exams or IAS, IPS and those kind of exams. They want an extra IQ level to perform their studies. We are here to help you. So the stroke is another major cause for children, especially children with certain unique mineral deficiency. They get into this stroke. When they are very young, the children, they get very high fever. When they get a very high fever, they get admitted into hospital, and then they get subject to heavy antibiotics. Then they leads to epilepsy and so on. So we can able to diagnose the potential child who has epilepsy and able to give preventive treatment to epilepsy. And of course, hyperactive disorder is one common problem for both adults and children. This is due to the nano deficiency of certain minerals in the pineal gland. And we have a nano liposome which successfully reaches the pineal gland and helps to reduce the hyperactive disorder, as well as it promotes the sleep and associated disorders. Antimicrobial resistance, which I have discussed with you, a patient having prolonged urinary tract infection or serious lung disorder, even after treating them multiple times, still it comes again and again, nanomedicine is a solution. So in 50 days, we can completely handle the bacteria. Even in the case of tuberculosis bacteria, our medicines are working very well. In corona period, patients those who have undergone less than 90 oxygen level, they have been asked to vacate from the hospital. We have recovered children, patients up to 55, oxygen level 55, our nanomedicines recovered. Next slide. So this is our clinical trials. We have done it for autism, and you can see that in the media continuously that there is no medicine for autism. It is not true. So the challenge is crossing the brain barrier was the first challenge, and reaching the hypothalamus, various nucleus groups in the hypothalamus, and bringing the functional change in the child. This was a challenge to the current medical science, but it is not a challenge for AYUSH. So it is not a chance for AYUSH medicines. AYUSH medicines are successfully crossing the brain and able to bring the functional changes. See, in our country, there was a time there were teachers teaching 64 arts to students, and there were students learning 64 arts. So we had the capability and the knowledge to develop the brain to the highest level in the world. So if we cannot challenge, bring changes in the mental disorders, who else can do this in the world? You can see we are very good at brain for a very long time. Anything comes to mind, world comes to India. So all Swamijis are from our country. So whatever anything went seriously wrong with the brain or in the psychic disorder, people come and sit with our Swamijis and close our eyes because our knowledge on the development of the brain is very good. Next. So this is the clinical studies we have done it for autism, and a prospective open label double armed parallel design multicentric study evaluating and compare the efficacy and safety of traditional Indian medicine of Siddha. These are the medicines we have used, the Saraswati Thailam, Amrit Sanjeevani and Kunjari Medugu. Out of this, all of them are nano in nature. So we have followed DSM-5 protocol as per the American standards. The study has been between 12th November 2020 to 18th May 2021. So these are the doctors who have been associated with the trials. He's the principal investigator is from Parul Institute of Ayurveda and Parul Ayurveda Hospital, Gujarat. Next slide. So this is then these are the doctors from Pondicherry, Kolkata, Hyderabad and Bangalore. So this is where we conducted the trials, and Sanjeev Biomedical's Research Center, Chennai, coordinate the entire trials. Next slide. See, I will give you one peculiar information. There is a disease called Alzheimer. So everyone knows Alzheimer. So far 600 billion euros has been spent on Alzheimer research. 600 billion euros spent on Alzheimer research. 14 years Western community has tried to do a successful clinical trial. 400 clinical trials failed so far. So this is the status of Alzheimer. So it is not. So now Johnson & Johnson and GE Healthcare, they join hands and they are going to perform collaborative research for Alzheimer. So this is an artificial intelligence company which we floated in Singapore, which gives predictive diagnostics. So if you feed certain data into our artificial intelligence algorithm, the algorithm will tell whether the child has autism, hyperactive disorder, epilepsy, or stroke at the time of birth. In our family hospital, in the past, we have been practicing from 16th century. That is 1614 we started our family hospital. So almost, 14th century. 1415 we have started our family hospital. Almost 600 years has gone. In the last 4 generations, we have treated 10 million children. So any child you bring the child to my hands, we will help you, we will work with you the very first day. The moment child is born, we can able to clearly tell you this child born with autism or ADHD, hyperactivity or developmental delay. Before you stop breastfeeding, we will recover the child. I am telling the doctors, we are not going to, we will work with you. This algorithm has been developed after 30 years of research. You can access this algorithm. The moment you feed the data of a patient, it will give you the complete mineral profile. Based on the mineral profile, it will give you what is the real root cause of the problem. See what happens, these mental health issues, only they confirm it only at the age of 4. Already time has gone. Okay, already the time has gone. So India right now giving birth to 2.5 crore children every year. Out of that, almost 10% having one kind or the other kind of neurological disorder and liver related or gut related issues. So we have a solution for that. You please come, let us join hands and help these children and mothers and to bring prosperity in their life. Next slide. Yeah, these are the various ways the software can be utilized. We will run it through later. Next slide. So this is the process we do follow for treating any children having mental health related issues. You please come to the stall, we will brief you. Next slide. These are the cities where children have come or adults have come to our model clinic in Chennai. That is not our purpose. We are a pharma company, but we have only one clinic as a model clinic, just to demonstrate the efficacy of our drugs. Next slide. We have taken AYUSH to 32 countries so far. So hopefully this year we will take it to another 20 countries. That's our target. So in India, we want to associate it with the local doctors and bring the international crowd. We already did it with 1 or 2 people where the AYUSH doctors getting attraction from the international crowd and they do very good health tourism. Hopefully it will happen here also. So we are in touch with the European Commission. European Commission has shown a lot of interest in doing collaborative research with us. They have visited our factory and our hospital and so on. So I travel across the world. We have good presence in Kenya, Tanzania, Uganda, like African countries, both East and West Africa. Thank you very much for everyone. It's a great honor bringing me here and stand before you. I thank Mr. Arulvel and my AYUSH CEO and the founders, as well as Dr. Sendilvel. I don't know where is he. So yeah, we thank everyone and all the doctors. You please help us to help the humanity. Thank you.